Hello everyone, we are from Bishop Labs.
My name is Jack Draper, and I'm the Chief Marketing Officer.
I'm Carly Current, and I'm the Chief Financial Officer.
And I'm Jake Traster. I'm the President of Business Development.
We produce the Bishop Malaria Testing Kit, a saliva-based test that we hope will replace traditional blood-based tests.
The Bishop test is more accurate, affordable, and less scary for children as opposed to traditional blood draws.
Malaria is one of the most fatal diseases in the world, killing over 1 million people annually across the world. Most of these deaths occur in Africa because of the poor medical infrastructure and subtropical climate in this region.
The country on which this marketing campaign is focusing is Burkina Faso. It is a landlocked country in Western Africa with limited resources and infrastructure. Burkina Faso has the 12th highest malaria rate in the world, being the #1 cause of death for children under 5 years old. Furthermore, 70% of the Burkinabe children are hospitalized for malaria before the age of 5. The Bishop test will aim to reduce these rates while also reducing the cost of testing for malaria.
In Burkina Faso, 30,000 people a year die due to complications of malaria. 80% of the population resides in rural areas and lives off $5 a day or less. They also have the 9th lowest density for physicians of the entire world. The Bishop test, being a self-administered test, would be able to reach many of these people living in rural areas who don't have access to a doctor. According to the World Health Organization, there is a direct correlation between the number of tests administered and the number of cases reported for malaria. This shows the prevalence of this disease in the country.
So this is the Bishop Malaria Testing Kit. Every kit has 4 components. The first component is a saliva collection tube that has a removable funnel. The second component is the antibody that tests for the malaria antigens in a person's body, PSSP17. The last component is a red cap that will be put on the collection tube once the sample is collected. How to use the Bishop Malaria Test. Fill the tube with saliva to the line using the included funnel. Unscrew the funnel and place the sample aside for later. Pick up the other tube containing the antibody solution and unscrew the cap. Pour that solution into the saliva sample and cover the tube with the red cap that is included in the kit. Label the tube with the patient's name as to avoid mix-ups. Shake the contents to ensure adequate mixture and place the tube aside, waiting 3 to 5 minutes for the results. If the contents of the tube are clear after waiting, the test is negative. If the contents are red, the test is positive.
Rapid detection tests, or RDTs as they're commonly called, is a standard way of screening for malaria. They do this by testing for the malaria antigen that is present inside of a person's blood. But studies show that this same antigen is also present inside of a person's saliva. Traditional RDTs are only 25% accurate, while the Bishop test is accurate over 85% of the time. The Burkina Health Foundation could purchase preventative resources, but these products do not always work. And even when they do, Burkina Faso has one of the highest malaria rates in the entire world. Finally, the Bishop test is more affordable than its competition at $5 per kit, while RDTs cost $15 per kit. By partnering with us, the Burkina Health Foundation will be able to save money while also saving lives.
The Bishop test will increase awareness of malaria in Burkina Faso, preventing spreading the disease and detect malaria early enough for treatment. This test will be marketed for use on children, as it does not involve needles and taking blood. The children are the most susceptible to the disease, with 45% of the Burkinabe population being under the age of 14. Administering the test to children will prevent malaria-related deaths to the largest segment of the population. Children are the primary targeted subjects, but their parents or healthcare professionals will need to administer the tests. This means that the test will be marketed toward the parents with the angle of keeping their children safe.
The implementation strategy of the Bishop Malaria tests in the first phase, months 1 through 6, is to arrange an agreement between Johns Hopkins University, us, Bishop Labs, and the Burkina Health Foundation. This agreement will finalize how to manufacture the Bishop test, including the PSSP17 antibody. Our goal is to have the Bishop test readily available by month 4 in Burkina Faso. This leaves the remaining 2 months available to train and fully distribute the product. Our plan for the Bishop test in phase 2, months 7 through 12, is to increase the market saturation of our product. We plan on doing this by investing in the channels of distribution, the most important of which is the Eureka Hospital. We plan on teaching the doctors at Eureka Hospital how to administer the Bishop test while also receiving feedback and looking for ways to improve our product. By the end of this phase, we hope to administer our product to over 10,000 Burkinabe.
There are several reasons why we would like to work with the Burkina Health Foundation. The first of which is their partnership with the Eureka Hospital. They work with the Eureka Hospital that serves over 20,000 people per year, a lot of which are malaria cases. All of these people could be helped by our product because we could use this product to screen them for malaria without going through the hassle of working with blood tests. The second reason why we would want to work with the Burkina Health Foundation is because of their distribution system. It's very hard to work in Burkina Faso, mainly because of the infrastructure that's in the country being so limited. The roadways and main distribution channels are extremely limited and can only be accessed by people who have been in the country for a while and know the people. The third reason why is because they are certified by the Burkina Faso Ministry of Health. This is a very rare certification that is only handed to charities that have been in the country for a long time and work with the people on a consistent basis. The fourth reason is because they partner with other NGOs that provide healthcare services, such as a Spanish NGO that provides eye care services to Burkinabe, which is sort of related to what we're doing, but in the vein that they're serving a problem that's needed there as is what we would be doing. The last reason is because the volunteers at the hospital are all Burkinabe, meaning that when the patients come in, they immediately know and can understand the workers there, meaning that there's no language barrier within the people and the patients, making it easier for the people to understand how to take the test and also to learn how to take it on their own once they leave the hospital if they need to again.
Burkina Faso Ministry of Health official Lene Subgo has an ambitious goal of reducing malaria rates in the country by 50% by the year 2019. This plan is hindered by the fact that cotton production, one of the highest exports in the country and biggest contributors to its financial resources, has been underproducing for many years, and future projections are significantly lower than previously estimated. One of the ways Subgo is addressing these challenges is by continuing the implementation of the public school curriculum to teach malaria prevention. Children are learning how to avoid contracting the disease and what to do if they show symptoms of contracting one of the 4 different strands of malaria. These symptoms include severe fever, violent shivering, and profuse sweating. Our product fits perfectly in this program because teachers can show the students how to use the Bishop test, and parents will find the results easy to read. As use of the Bishop test increases in Burkina Faso, less time will be spent by physicians screening for the disease, and more time will be spent curing it. This is an ideal time for the Bishop test to enter the Burkina Faso market because of Subgo's ambitious goals and desire to teach malaria prevention to children across the country. Overall, the Bishop product is more affordable, more accurate, and less painful than our competition's products.
We look forward to working with the Burkina Health Foundation in order to save innocent Burkinabe.
Hopefully, our efforts will reduce the malaria rates in Burkina Faso, minimizing the risk of contraction for Burkinabe children.
Did you hear that?
It's probably nothing.
There it is again. I'm gonna go check it out.
One million people die of malaria every year, most of which are under 5 years old. These deaths occur due to inaccessibility to medical care. The Bishop test is a self-administered saliva-based malaria test that is more accurate and eliminates the pain of blood draws. Our goal is to distribute this test throughout the impoverished countries plagued with malaria. Please contact us today to help children who cannot help themselves.